Hi, Blair here with MXM. A little bit surreal here on November 18th. Again, sitting in one of our gyms, empty here, the Wenatchee location. I started these back in March. I think the first one I did was maybe March 16th or 17th, something like that. Talking to you from an empty gym and talking about, how long people should be planning. They should be planning, as you're improving your operations, you need to take an optimistic standpoint that you're going to open soon. And from a financial standpoint, you need to take a very pessimistic approach and be planning for 3 to 6 months. Well, we were closed for 6 months and a day. Then we opened. We were open for just short of 6 weeks. And then Governor Inslee and the Washington State Department of Health, Doctors Kathy Lofi and John Wiseman, decided to roll back the economy in Washington State in order to curb the spike in coronavirus cases. So here we sit again in an empty club. Some of the things we noticed when we opened was what a lot of you noticed: how much your members loved the environment that you created. A couple other things we learned. We learned that you're better off having a mask all the time policy if you don't want your staff to have the joy sucked out of their lives by being mask police and having to police all the ambiguities in a mask policy. So we put in a mask policy that said mask all the time, unless you're on a piece of cardio, so we know where you are and where you're facing, or in a group fitness room and you're at your spot. In those two conditions, we knew there wouldn't be traffic walking back and forth, and that you'd be in one spot for an extended period. That proved to be a really good policy. We got a lot of thank yous from a lot of members. We do service a tremendous amount of the healthcare community in these clubs, from Confluence Health and Columbia Valley Community Health. So a lot of kudos from both of those employers, and Confluence Health is our largest employer. And our staff's lives were made much easier. Our teams had more joy in their day because they didn't have to be constantly reminding people, and that's not pleasant for the member either. So we learned that. We learned that the stuff that we put in place, some of the temporary barriers and that we used, people really, really appreciated. They loved the airfix systems. They loved the smell of fresh air coming into the gyms. I think our trailing 6-week Net Promoter Score stands at about 91 combined between the two clubs. We learned that we didn't have near the cancellations that a lot of clubs had. So our Net Promoter Score between the two clubs, and likely to continue, are exceptionally high all the time under normal conditions. And that tended to pay off. So we were closed 6 months, expected to lose 10 to 12% of our memberships. So as that attrition catches up with you, not even a whisper close to that. So about maybe we lost 50 more memberships than we would have otherwise in the first few weeks, and then it completely normalized. Now we're only open 6 weeks, so what do I know, right? And we have to get back on our feet again here. Customer experience works. I think we've already seen some of the ROI on our efforts over the years in these clubs compared to a lot of the other clubs out there. What doesn't work is closing this economy down and closing clubs that aren't causing any outbreaks in an effort to have great optics for the people that live in a tremendous amount of fear about COVID-19. And that's what I feel is happening in a lot of these states as clubs get closed. I'm happy to see that in areas, some physicians are stepping forward, some medical groups are stepping forward and saying, no, do not close these clubs. They're not causing outbreaks and we need them. That's it. We'll be talking more about this. Sorry for the long-winded video this morning.